Hello and welcome to the Dose of Wellness podcast. I'm Sally, this is Cindy. We're both pharmacists and co-founders of Vitaceuticals. Today we're talking about one of the most searched topics online, and that's supplements and fertility. People aren't just searching what supplements help you get pregnant. They're asking things like, why am I not getting pregnant if everything is normal? How to improve egg quality naturally? How to boost sperm count naturally? What are the best prenatal vitamins for pregnancy? Can stress affect fertility? And what supplements should I avoid when I'm trying to conceive?
Fertility is so emotional, such a vulnerable topic and very individual for everyone. When answers aren't clear, everyone goes to Google. Today we're joined by fertility specialist and expert Dr. Marcela Martin. Thank you for coming. And together we're going to unpack what's evidence-based and what's some misconceptions and myths about fertility.
Right, well, thank you so much for inviting me today. I really appreciate your time.
We're honoured to have you.
So happy. When people hear fertility specialist, they immediately think IVF. But what does your day-to-day look like?
Oh, my day involves a lot more than IVF. I look after women from their teens when they're talking about contraception all the way through to the menopause phase and trying to hold their hand through that phase of life as well. Of course, most of my day is involved with that middle range where women are trying to fall pregnant, and I'm also there for those women who are planning their fertility future. So they're not necessarily ready to have a baby, but they need to plan and think ahead, and whether egg freezing is something for them.
Yeah. Many people are searching things like, when should I see a fertility doctor? How long should I try before I start to get help? Is it normal for it to take a year before I get pregnant? Are you seeing women like at an earlier stage of life now?
Well, that's an interesting question, because when I first started this, and I've been in private practice for over 15 years now, it used to be just a crisis appointment.
Yeah.
You know, people were like, we're not getting pregnant.
Yeah.
I'm 39. It was always a crisis.
Yeah.
Thankfully now, with more education, and I think social media has played a part in that, women are asking questions sooner about their fertility potential. And we're starting to see younger women who are just starting to get educated about their fertility potential. And I think this is a new generation coming through and asking more questions.
And is that partly because people are also getting married later in life and
Yeah.
they're worried about their
Correct.
clock?
Correct,
basically?
yeah. Women are
Yeah.
getting married later, they're having careers, they're having choices, they might educate themselves and have to do an extra degree for whatever career they've got in mind. Women have got more and more choices, but our fertility potential is finite. So with the advent of egg freezing, women are now starting to have that potential to sort of say, right, I haven't met Prince Charming just yet. I might just park some eggs here.
Yeah, very
And therefore that
interesting.
raises all these other questions about how can I look after my health and how can I look after my egg quality.
What's the prime age for freezing your eggs?
Ideally under the age of 35. We will get women at all ages. We'll get a 39-year-old, 40-year-old coming in and asking these questions. It's not an ideal circumstance, but sometimes that's the only tool we've got. And as long as they understand the pros and cons, we will walk them through that process. But our successes are primarily in those women under the age of 35. So we want to have these discussions with the 28 to 32-year-olds.
Yeah.
We don't want to leave it to the last minute.
Yeah. Let's dive into some supplement questions to do with fertility. So what supplements do you recommend for people to help them to get pregnant? There's a lot of research on fish oil, vitamin D, ubiquinol. I saw you did a reel recently on NMN and I was really excited looking at that.
That was a bit controversial.
Yeah.
So the things that I like to discuss with patients, it depends on exactly where in their journey they are. So if we are looking at getting pregnant, then the key things are making sure your folic acid is in good levels, important for baby's development. Vitamin D, iron, there are a whole plethora of things that need to be checked, but they're the key ones that are most important. And we need to talk about the appropriate prenatal vitamin, which will have a whole heap of other things that they need as well, such as iodine and a bit of calcium and magnesium and zinc and all those sort of other little things that need to go towards building a little human. So that's the category of people who are trying to fall pregnant. But of course there are other people who are about to try and conceive, but maybe they're just trying to make an embryo. Maybe that embryo's got to go through a journey of genetic testing, so they won't actually be pregnant for a little while longer. So in the older women, where we might need to do a bit more workup before we put an embryo into the uterus, we've got a different timeline to play with. Those women, especially those in their 40s, they're the ones that are going to benefit more from more intense supplementation.
Yeah.
That's my experience. And those sort of things we raise are the coenzyme Q10s, and that's where I think NMN has a potential role to help with egg quality.
Yes.
But
So you do see that there's some supplements that do help with egg quality?
I do.
Yeah.
Now, the limitations we saying that, especially with NMM, is that there are no good human studies just yet. But these women in their 40s, they don't have the timeline to sit and wait for those.
Yeah.
So as long as you counsel them carefully about the pros and cons, I think in the future we will be saying, we will probably be putting NMM or NAD plus if we can. As you know, NMM is the building block for NAD. We'll probably be putting it in the little petri dishes where we grow our little embryos.
Oh, wow.
People are studying that. That's
amazing.
where we're up to in science.
Yeah.
We haven't quite got the formula right, but there is that hope that we're going to move in that direction. So I limit that supplement to that subgroup of people.
Yeah.
And sometimes we use it in young women who have diminished ovarian reserve. So those young girls who are in danger of going through perimenopause, menopause in their 20s or early 30s. So I treat them the same way as I would my 40
Yeah.
So I think, you have to be very careful and select the patients that you use it in and give them clear guidance of where we're up to with the research.
Yeah.
Very individual.
Correct. It has to be tailored, doesn't it? There's no blanket answer for everybody. Yeah.
How about for men? Is there any supplements that can help with improving sperm quality?
Yeah. As far as supplements for men go, the key factors in improving sperm go hand in hand with supplement taking. But once you get these guys taking supplements, they're also generally getting around to improving some of the lifestyle factors. So it's really hard to differentiate what's really going on here. But, for gentlemen, it's making sure their weight is good, they're sleeping well, they're not smoking, definitely not vaping, cutting down on coffee and cutting down on caffeine are all important factors.
Yeah.
With that comes also making sure that they are getting good nutrition. So if you can get good nutrition, fantastic. Pretty hard to do in modern lifestyle. So that's where supplements can play a role. So there are quite a range of men's prenatal vitamins now out there. And the key elements in most of those that may make a difference are having some zinc in those supplements, so several antioxidants, and also some coenzyme Q10.
Yes,
as well.
Are you finding men more open now to discussing their fertility? Because it used to be very taboo for men and really just a women's issue.
Yeah, I think more and more men are there to support their partners when they go through fertility journeys. I think more men are open to it. When there is a male factor, so when we find that the problem why a couple's not getting pregnant is because maybe there is a problem with the sperm count or the health of the man. Men are starting to become more opening to counselling because it hurts them as well. This is a change in the last few years. We're getting more men's group, more discussion online about these things as well, which is excellent. Excellent.
So do you have all that services in your clinic?
Yes, we do. So in my clinic, we will have counsellors as part of your IVF journey. It's not an extra. It's part and parcel.
That's amazing.
Yeah. Both men
Support,
and women.
yeah.
Individually or as a couple.
Yeah.
People are always asking is what kind of test should I do before I fall pregnant? Like, should people be doing pre-testing as well?
Yeah, absolutely. So the key, if I can put them into a couple of subgroups. So if you're planning to fall pregnant, one of the things I'd like people to do is look at the vaccine that they've had in the last couple of years, go to their doctor, make sure their measles, mumps and rubella is up to date, check that their chickenpox cover is up to date. Just because you had these things when you were growing up doesn't mean by the time you go to have a baby you're still covered. They're live vaccines, so you need to get them done and out of the way before those chickenpox. People don't realise that you can run out of immunity and it's devastating to a baby if you get chickenpox while you're pregnant.
As a woman?
Both to the mother and to the baby.
Oh,
so
wow.
These are things that need to be ticked off. Other things are, there's lots of new genetic tests out there that people don't often realise are available to them. There are small genetic screens which are free, which are government funded, through to more complex genetic screens which require some money out of pocket.
What are they testing?
So they're testing for things like cystic fibrosis, spinal muscular atrophy, and Fragile X, which is important, and that's a free test.
Yeah.
But that test takes a few weeks to come back.
Yeah.
So that's something you do before you get pregnant. You don't want to do it as you fall pregnant.
Yeah.
It's very stressful waiting
Yeah,
for those
definitely.
results. And then if you're positive, your partner has to get tested, because you both have to be silent carriers
Yeah.
for the potential for the baby to be affected.
Yeah.
I'm still surprised that there isn't enough information out there.
Yeah.
Yeah, I've never heard of them.
Yeah.
Yeah.
And in terms of getting your body ready, you want to make sure your pap smears are done, make sure your dental work's all up to date.
All the things we hate.
Exactly. But also starting your folic acid.
Yeah.
And again, making sure your folate levels are good.
And how soon
before you conceive?
were you planning to?
Ideally, 3 months.
3 months.
But even if you start the month before, it depends on your diet as well. If you have a good, healthy diet, that should be enough. And again, lots of our cereals and breads in Australia are fortified.
Yeah, we're
with
so
folic
lucky
acid.
with
Yeah.
that. Yeah.
So we certainly don't have a huge problem with that in Australia.
So would you test things like iron, vitamin D?
Absolutely,
Yeah.
absolutely.
And is there like a baseline that?
Yeah. So the way I like to describe it is that for most of my patients, so vitamin D, we want, an iron in particular, we want to build our stores. So we want to store some extra iron in our liver. We want to store some extra vitamin D in our bones, because as soon as we start growing that little human,
That sucks it
they're
out.
going to take it all
Yeah.
away from you.
Yeah.
And it's so hard to bring those levels back up
Yeah.
during the pregnancy.
Yeah.
So we want to be
Ahead in
one
that.
step ahead.
Yeah.
And that's why ideally 3 months preparation
Yeah.
is good for all of those.
Yeah.
And just getting those levels done
Yeah.
and checked.
One interesting thing that happened to me, actually, my iron got so low that I started to crave ice.
Yes, yeah.
And then we found out that it was because my iron was so low. It was
Absolutely.
making me just, when I'd go through the McDonald's drive-through, just ask them for some ice.
Yes, I've heard that story. Yeah.
That's very bad.
Yeah.
There's a lot of research about like the methylated folate and like versus folic acid, and people that have that genetic called MTHFR.
MTHFR gene.
Yeah.
We got to be cautious with that. Testing for that particular gene, there's lots of variations, and most people in the community will carry one kind of variation. It's actually quite common. To have a double dose of the mutation, that if I could simplify it that way, that's when you start to get in trouble and you don't process your folate very well. So if you're doing that genetic test, it should be done with what we call a fasting homocysteine level as well, so to really assess whether you are, processing that appropriately in your body, and what particular kind of folic acid do you need? Do you need higher dosage as well? So some people might need 5 milligrams rather than 5 micrograms. 500 micrograms. 5 milligrams versus 500 micrograms. There are different issues that might necessitate that. Say, for example, you're on medications that might interfere with folate, say anticonvulsant medications, if you've got epilepsy, Formin, if you've got insulin resistant, PCOS, those sorts of things.
Yeah.
So we always need to consult with your doctor, with your GP and your specialist, if you're seeing a fertility specialist or if you're seeing an endocrinologist, etc. It's always worth having a chat and being frank and open about your supplements that you're on. So that everyone can help get the best out of them for you.
Yeah, we see many people come in and just self-prescribe, I read I should boost this and this and this. I'm like, but go to the doctor first, have all your baseline testing, see what's needed, where the gaps are.
Yeah, look, I couldn't agree more. Being open about it. Like, I specifically ask for supplements, not just medications, because people don't always see it in the same same basket. And there's also, it's important to understand when you stop your supplements as well. So some supplements where we don't have enough safety data, we will say, right, stop this as soon as like if I'm doing IVF on them, as soon as I put an embryo in, I might say, okay, this supplement needs to stop at this point, because at that point you're technically pregnant and we don't have any safety data on this or that. So that discussion needs to be had for each and every supplement as well.
So a common thing that people are also searching is what deficiencies can cause infertility. Is there anything that you actually see?
Well, I think the best way to think about that is if you are showing deficiencies in your diet, and that's coming through in vitamin deficiencies, your body's not in optimum condition to grow a little human. So sometimes the body will slow down the process. So it doesn't mean you can't get pregnant, doesn't mean you're infertile, but we need to optimize the environment. And that's where going in to see a fertility specialist, having the appropriate tests done, having individualized tests
Yeah.
because again, you can't just run every test on everybody. We'd bankrupt Medicare. We don't want to do that. So we need to be thoughtful and mindful of the tests that we put people through.
Yeah.
And target those exams and then target the appropriate supplementation should they need it. Yeah.
How about stress? Can stress affect fertility? There's so many stories of people who are always really trying to have a baby, and then once they're told to relax and just enjoy themselves, they find out they're pregnant naturally.
I'm very careful never to tell my patients just relax. I'm sure they've heard that before they've come to meet me.
Makes you more stressed.
Yeah. But look, stress does play a part, I'm sure. Hard to measure that. Sure, we know that cortisol levels go up. That's going to disrupt your sleep. That's going to disrupt how you feel about yourself, how you function every day, whether you go to that effort to cook yourself a healthy meal and exercise or not. So it has a knock-on effect. We just can't measure it. I would like to hope that we can take some of that stress away by giving people a plan, a direction, and that's what fertility specialists strive to do. It doesn't always mean you have to do IVF. It's just, okay, this is your plan B if you don't get pregnant within this timeline while you're fixing these factors. So can I magically take stress away? No. Is IVF stressful in itself? Yes. Of course it is. Yeah. But I find if we can give people a target, and, that direction when they're going through their infertility journey, that contributes a little bit, I hope, fingers crossed, to reducing some of that stress.
When they speak to a professional who knows what's common, how long it takes, whenever I go to a doctor for something and he says, oh, that's normal, I'll be like, oh, okay. I was stressing so much about that. He's like, that's normal with that. And I'm like, okay. So it's like you can't just what you're thinking always assume that's the right thing.
Correct.
Yeah.
Another huge search term is, why am I not getting pregnant if everything is normal? Like if we've done all the tests and there's nothing wrong, like no eggs, like the egg quality is good, the hormones are good, like the men, everything in the male partner is good. Do you see a lot of that as well?
The dreaded unexplained
Unexplained,
infertility. Sometimes we don't have the answers as to why they're not getting pregnant, but I like to at least remind them we've got a great starting base. We've got eggs, we've got sperm, we've got a uterus, and let's go. All right? Just because we haven't got an answer doesn't mean that it just means that at this point in time we haven't invented the test that's going to give you the answer. Right?
Yeah.
And the best test is actually IVF, because when we're doing IVF, we get a unique opportunity to watch how that sperm and the egg come together down the microscope. And it might be
Just
that,
amazing.
you got pregnant with baby number 1, but that was actually quite lucky. The sperm count might be normal, but they're actually quite lazy when they get down to it, when they meet up the egg. And we can see it under the microscope.
Wow.
So sometimes we find the answers on the journey.
All right, let's have a bit of fun with this one and clear up some common myths. Myth number 1, supplements can fix infertility.
No, I wish.
More supplements equal a faster pregnancy.
Absolutely not. Look after yourself. Don't take too much of anything.
Or prenatal vitamins are the same.
Absolutely not. But we do have a lot of choice in Australia, so we're pretty lucky.
Very lucky. Fertility is a woman's issue.
Well, if you want to be a solo mum, sure. But it takes two to tango. Yeah.
And natural always means safe.
Not the case. At the end of the day, wherever the chemical's coming from, whether it's from a plant or a factory, it's still a chemical, and you guys as pharmacists know that, that interacts inside your body. And we've got to make sure it's safe. It doesn't interfere. If you're doing IVF, some of them can interfere with your IVF drugs. Sometimes I get unusual results and I go, whoa, what haven't you told me? And also, everything's about that little baby. We've got to make sure that whatever you're taking is safe in those dosages for a little embryo that's grown in your uterus.
You have the best job.
I know, you can see miracles happen every day.
That's good.
So recently there's a lot of chatter on socials and in the media about hormone disruptors in fragrances and hormone disruptors in sunscreens. Have they done more research in if that's actually affecting fertility? Are you seeing more infertility?
Yeah, we're seeing more and more of these lectures pop up in international conferences as we're gathering more and more data on it. But at this point, what I say to my patients is limit the perfume, special occasions only. I have that conversation as I do about microplastics as well. So they're the key things that I'm more concerned about, and I have a chat about those in my visits.
So scary that something we've been using so innocently all this time, and the biggest advice is wear sunscreen and wear sunscreen every day. And we need sunscreen.
Well, we still
We
need
still need
sunscreen.
sunscreen.
We still need sunscreen to look after self. We still need to get vitamin D. So it's all about the balance and
Finding the
making
right
sure
one.
that we're using the right products now. As we get more and more educated about these things, we get more information being posted on reputable websites like New South Wales Health.
So some practical takeaways: start at least 3 months before trying, get baseline testing and focus on foundational nutrients first. For IVF patients, don't delay treatment, don't chase supplements, and ask what's evidence-based. For men, sperm quality is half the equation, and testing plus nutrition plus lifestyle all matter. How about you, Dr. Marcela? Do you have anything to add to that?
I think you put that nicely. Thank you very much.
That's a perfect note to finish on. Thank you for joining us, Dr. Marcela Martin. Thank you to everyone for listening. Be sure to follow Dr. Marcela Martin at Dr. Marcela Martin. Subscribe for more videos.
Thanks, guys.
Thank you. Thank you so much.